The reason for the drop is basically COVID. I don't think that probably come as any surprise, because certainly in the early parts of the year, the UK shut down basically all of their treatment because cancer patients are in the high-end risk group. So we actually had to adapt our oncology provision on Ireland, and I've got to say the team in oncology have worked absolutely superbly to undertake treatments on Ireland that they'd never done before, learnt new things and been able to adapt for the patients.
So is this something that could become a more long-term thing then? Will there be an enhanced provision on Ireland going forward?
No, because it's not an ideal solution. I think I've made quite clear before that we've got to recognise as a small island we are limited in what we can do. The team were brilliant at stepping into the sort of void that was created during that period with COVID, but we do have to recognise we do need to partner with third parties in the UK to be ensure that our patients have access to the level of oncology treatment that they require.
So what's capacity like in the UK now? Are you still sending fewer patients, or is it starting to creep back up?
So capacity was creeping back up, and then obviously things have now changed in the UK. At the moment, with our partners, we are maintaining pretty much the turnover that we would expect. But obviously there's patients themselves that are nervous about travelling as well at the moment. And, that's quite understandable, particularly with what's going on in the UK. So we have to factor that in as well. There has been occasions where patients themselves have said they don't feel comfortable travelling, and we have to respect that.
You have touched on it there, but is it safe for patients to be going to the UK?
Yeah, I mean, I being perfectly honest, I was honest at the press briefing last week. We can't 100% guarantee that there is no risk whatsoever, because clearly with a virus it's invisible and there is a risk. But certainly we make things as safe as we possibly can, and being in a hospital environment is still the safest form, really. We issue advice to patient transfers around PPE usage, and also that they shouldn't go out into the local community. It should be to the hospital and back again.
And there were also figures on the 14-day appointments for newly diagnosed patients. They should be seen within 14 days. That's the aim. That seems to have dropped quite a bit this year, just dipped under 70%. What's being done to fix that?
It has. We haven't been able to have the visiting oncologists in the way that we have previously because, again, about the pandemic in the UK. We've also had an impact from the fact that the number of referrals has gone up into the service too. So we are working hard to bring additional resource in to bring those times right back down.